Hello and welcome to the first presentation of the risk analysis module. In this presentation, we will explore the concepts of hazard, risk, and exposure, learn about definitions and types of hazards and risks, and get introduced to the concepts of variability and uncertainty. We naturally assess risk in the course of our daily activities. For example, we assess the risk when we're driving. We need to decide when to pass another vehicle. Or when we cross a street, we usually look at both sides of the street before crossing. We'll do the same mental process. We collect information, we analyze that information, and reach a conclusion about the level of risk. All of us react differently to risk situations. Before you started this presentation, you were invited to take a survey that asks you to look at some pictures of different scenarios and assess the level of risk for each scenario shown. Please take a minute to look at the pictures on the slide. Your perceptions about these risk scenarios will be different from that of others. Why do you think those differences occur? The level of risk we perceive depends on information that we focus on, our previous experiences in similar situations, or even our culture and personal beliefs. In crisis situations, most people act upon their perception of risk, which might not be accurate. Our goal in this presentation is to introduce you to objective and scientific methods to estimate the real risk through the process known as risk analysis, and show you how it is applied to food safety, animal health, and food defense. Let's start with the concept of hazard. We use the word hazard to describe the intrinsic properties of a substance, microorganism, or product that may cause an adverse health effect. Hazards can be biological, chemical, physical, and radiological. A complete list of the biological and chemical hazards in food safety and defense can be found on the course site, as well as a list of animal health hazards. These are examples of different types of hazard. It is important to take into consideration the zoonotic nature of a hazard. That means that this type of hazard can affect both animals and humans, like the high pathogenic avian influenza, or be asymptomatic in animals and only adversely affect humans, like beef cows shedding E. coli O157H7 or poultry shedding Campylobacter or Salmonella. Whenever a human or animal comes in contact with a hazard, a substance, microorganism, or product, we say they were exposed. The exposure dose is the amount of a microorganism or chemical substance the human or animal is exposed to. Usually, the exposure dose for a biological hazard is expressed in number of cells or viral particles. If it is a chemical hazard, then the hazard dose is expressed in milligrams or parts per million, milligrams per kilogram. A radiological hazard is measured in sievert, a derived unit of ionizing radiation dose. Any amount of physical hazard will be considered dangerous for humans. Even if a human or animal is exposed to a hazard, clinical symptoms will result only if the exposure dose has reached infectious levels. People or animals can be exposed to hazards by different routes: through air by inhalation, direct contact with secretions from another animal, through ingestion of contaminated feed, or contact with fomites, farm personnel, as well as trucks and equipment that can transport infectious organisms. Risk is a function of the hazard combined with exposure to that hazard. For example, what is the risk that a dairy cow gets infected with foot and mouth disease when there is an infected dairy farm 3 miles away? In this scenario, F&D is a hazard. The dairy cow's exposure to this hazard is minimal if there is no communication or interaction with the neighboring farm. However, if there is a track that travels between the farms, then the cow's exposure increases, as the track might bring the hazard from the neighboring farm. Even if the cow is exposed to the FMD hazard, is the exposure dose high enough to make the cow sick? If the exposure dose is low, then the risk of getting sick is low. The cow's health is also a factor in determining risk. The more vulnerable the immune system is, the smaller the dose needed to sicken the cow. In summary, the risk will depend on the type of hazard, the exposure dose, and the condition of the host. Now let's talk about the context within which hazard, exposure, and risk analysis are applicable: food safety, animal health, and food defense. Food safety refers to the condition that food is free of unintentional adulteration. To assess food safety risk, we multiply the probability or likelihood that an intentional adulteration will take place by the severity of a hazard if present. For example, what is the risk or statistical probability that a consumer will get sick with salmonella as a result of eating a hamburger? How sick is the consumer likely to be? In this instance, the likelihood of the salmonella hazard applies to the presence and the count of bacterial cells per portion of meat, food preparation, and sanitary standards. To compute food safety risk in this case, we multiply the likelihood of salmonella hazard by the severity of the clinical symptoms the consumer will develop, such as gastrointestinal upset, hospitalization, or, in extreme cases, life disabilities or even death. Similarly, we assess an animal health risk by determining the likelihood that a pathogen will enter a country through a fomite, humans, animals, or commodities, multiplied by the likelihood that the pathogen infects susceptible species. For example, usually countries are worried that an exotic disease will enter the country being carried by a group of animals or an agricultural commodity. To prevent this, government agencies perform a risk assessment to determine the health of the animal or food commodity in the exporting country with regard to specific diseases, specific countermeasures that country has in place, the likelihood the species may be infected, and the likelihood susceptible species in the destination country may be exposed to the hazard and get infected. Now let's consider risk in the context of food defense. Food defense is concerned with protecting the food system from intentional adulteration. Intentional adulteration is when an individual deliberately adds something to a food in order to harm people, to commit fraud, or to otherwise disrupt the food system. A food defense risk is the sum of the vulnerability of the system that an adversary exploits, the severity of the hazard used, and the intention to cause harm or adulterate the food system. Consider this hypothetical story. Milk is collected, pasteurized, homogenized, packaged at the milk processing facility, and distributed to retail locations. Let's say an individual observes the processing plant, timing the truck deliveries and looking for entry points into the system. He successfully identifies a way to break into the plant and gains access to the fluid milk itself, and adds an unknown substance to the milk. After the milk has been processed and packaged, it is distributed. Assuming that the adversary was able to add a large amount of the hazardous agent, we'll start seeing some startling results within 24 hours. Consequences could be as minor as a stomachache epidemic or as severe as a national emergency. In the worst case scenario, hospitals in the area will be flooded with children all with the same symptoms, and the public health system will be overwhelmed. When we're trying to analyze risk, we should never forget about the rule of natural variability within a specific environment and uncertainty related to a lack of knowledge. We will always have variability in the situation we're trying to assess. If we look at processing plant, we have lots of variability. For example, milk is collected from different farms, the health status of cows can change, The quality of milk may be impacted by environmental conditions, and new workers may be hired who are unfamiliar with protocols. Even though we try to control and reduce variability, it is not possible to eliminate it entirely.
Okay.
Uncertainty is lack of knowledge about a specific environment or system. However, we'll never be 100% confident that we have complete knowledge of a certain environment. We can reduce the level of uncertainty and control variability by implementing a systematic and consistent data collection and analysis process, but there is always a chance that hazard will be present.